Hello and welcome to a special podcast from West Hertfordshire Hospitals. My name's Ashley Reece. I'm one of the paediatricians and also the Director of Medical Education. And over the past few years, I've been leading a team working on a project to call ourselves a teaching hospital. And I'm delighted to report that in December 2021, we achieved our aim and our name was formally changed and we are now the West Hertfordshire Teaching Hospitals NHS Trust. So in this podcast, we'll discuss what that means for the local community, the hospitals in our trust for our staff, and of course, the most important people, our patients. We'll hear from the Trust's chairman, from our colleagues involved in research, in education, teaching and training, as we formally launch ourselves as the West Hertfordshire Teaching Hospitals NHS Trust. So to begin with, it's great to welcome Andrew McMenemy, who's the Chief People Officer here at West Hertfordshire Hospitals. Andrew, thanks for coming to talk to us today.
Thank you, Ashley. It's a pleasure to be here.
So you've been in the Trust for a couple of years, and I'm just interested to know your thoughts on this project when you heard that we were wanting to make ourselves a teaching hospital. What did you feel that will bring to the organisation?
I think, first of all, it kind of aligned with what we wanted to do more generally regarding education and development within the organisation. I think teaching hospital is a bit of a pinnacle, a bit of a badge of honour that you're looking for. It does wonders for the reputation of the organisation, but it's broader than that for me. It's about changing and supporting development of the culture within the Trust towards focusing on the education development of the organisation. And I think teaching hospital coming when it came after or during the kind of pandemic, hopefully at the latter end of the pandemic, alongside the organisation's support and strategy towards enhancing development of our workforce, it's come at a perfect time. It creates a perfect opportunity for the organisation. It creates a perfect opportunity for our staff and also from those outside looking in. It creates a reputation that we can be very, very proud of within West Herts, and hopefully this is the first step and acts as a catalyst to really push the boat out for this organisation in terms of supporting and enhancing teaching for clinical staff, but also teaching and broader development and education for all of our staff.
So teaching and education is a part of our sort of core business, isn't it? It's what we do day in, day out. We've got lots of learners in the organisation, and so overseeing their onboarding and their work through the Trust, it could really foster an even more positive feeling of belonging and hopefully help with recruitment and retention going forward.
Yeah, I think that's one of the obvious benefits from teaching hospital status, and also having a reputation for an organisation that really cares for its staff. And the consequence of all of these is hopefully it leads to that better reputation, attracting the best quality candidates, retaining the workforce, demonstrating better levels of morale, which in turn will lead to better patient care and better quality of services for our local communities that we serve. So you're absolutely right. I mean, I think we're really looking forward to this opportunity for teaching hospital status, because the benefits to begin with are a change of name, but really the longer term benefits are absolutely phenomenal for this organisation and our local communities.
Okay, let's hear from some of our colleagues. They will introduce themselves, but first, here's the Trust Chairman, Phil Townsend.
My name's Phil Townsend. I'm the chairman at West Herts. Now, part of my role is to chair all of the consultant interviews as people join us. And I'm struck that over the years that I've been doing that, pretty much every single interview, the candidates will talk about the opportunity to teach. And so the change that we've made to gain teaching status is clearly important to the people we are recruiting and intend to recruit. But it's not just in name. One of the consequences of the change of status is that we will add a new non-exec to the board. And that role will have a specific responsibility for the teaching status. So I look forward to all of the changes that will come out of the back of this move to a teaching hospital.
Jane Barrett, Deputy Head of Education, Training and Development. Becoming a teaching hospital is testament to the culture of teaching and learning that I have been part of since I joined West Herts over 20 years ago. But what this means to staff now and in the future is that it enables them to be the best they can be in an environment where they will be supported to flourish. It also means that this is a start of our journey where we continually improve and work towards quality standards in education. It means that we will continually evaluate the impact of any funding investment we get and make sure that everyone has an opportunity to access continuing professional development funding. It means that we can look at expanding our placement capacity, growing our future workforce, making sure that we are embracing the use of innovative new ways to learn, which means digital advances, which means looking at our curriculum that will look at things like simulation and learning online. We must make sure we make the most of our knowledge, intelligence and research to establish what matters most to patients and trust staff. Making sure that we use leadership programs to build capacity and capability. And last but not least, that we learn lessons from the COVID pandemic about how to work differently with other resources, such as our colleagues in the private and voluntary sectors, and we form communities of practice to share that learning. It is a continual journey, but a very exciting journey, and I am absolutely thrilled to have been part of this project.
Hello, I'm Fiona Smith from our research department. I'm so delighted to have been involved in achieving teaching hospital status. I think this will help us continue to increase our research activity in collaboration with our academic partners. Research underpins excellent patient care, helping us to provide treatments based on reliable evidence of their effectiveness. I believe that research and education benefit us all.
So we heard there from Fiona Smith, who's the Director of Research and Education, Academia, as well as sort of teaching and learning. Research is a big part of that. And we've had a very big research and development department in the Trust over many years, and we've been part of clinical trials. And ultimately, these are important to help support new treatments or new ways of caring for patients, and to bring that into this teaching hospital conversation is really important for our patient population, being part of research going forward and being at the forefront of medical, clinical health developments.
The research area, you're absolutely right, is an area that we probably punch above our weight from a district general hospital perspective. I think it's something that our local clinicians and medical staff and research team are extremely passionate about. I believe in the last few years, what you've seen as an organisation that's embraced the development of research, that aligned with teaching hospital status it can only act as a good thing. It allows us to really, really enhance our both teaching and research together. They are aligned. The prospect of an acute redevelopment with on-site as well really gives us that opportunity to really push the boat out regarding research and education within the organisation. They both go hand in hand with each other. And again, they come back to that opportunity to enhance our reputation, but also to really be something that our local communities look to West Herts NHS Trust to be something they can be really proud of when it comes to leading edge research activities.
So I think that's really important and really helps to pull together all of the positive benefits of this project that we've run to really embed what we do each day in terms of education, teaching, learning, training, and research into our name so that we can loudly and proudly display that bit of our activity now as West Hertfordshire Teaching Hospitals.
Yeah, I mean, I think having it in the title and the name, and there'll be many people out there who very much appreciate and really understand the concept of teaching hospital status. I think where we just maybe have some challenges is making sure we make that teaching hospital status universal and understandable to many, many others who maybe don't fully appreciate and understand and really what is a landmark moment in becoming a teaching hospital and the impact that has. You cannot underestimate the reputational influence that teaching hospital has for new trainees coming out, medical trainees, and how that then leads into making sure you have an effective and sustainable workforce plan, especially around your clinical staff going forward. And we know at this moment in time, and we have had this issue for a number of years in NHS, that it's difficult to recruit to certain clinical and medical posts. Now, being awarded teaching hospital status and having that kind of vision that we've got within the organisation and enhancing the experience of our trainees, enhancing the experience of our clinicians is really, really positive in terms of supporting high quality but sustainability with our workforce going forward.
And we heard from Phil Townsend there, our Trust Chairman, who's involved in medical recruitment. And what's interesting is that doctor is a word from Latin meaning to teach. So from a medical perspective, teaching has always been part of our core and very much one of the basic skills, and teaching the next generation is very much what we do out there on the wards, on the job, teaching training. But it's much wider through the organisation, through our nursing, midwifery and other healthcare professionals. And we have links with many partner institutions, academic institutions, including medical students from University College London, our Overseas Medical School St George's, looking to bring another local medical school, Brunel, into the organisation, medical students from there, and also our nursing, midwifery and other healthcare professionals from University of Hertfordshire, University of Bedfordshire, and students from Cardiff, South Bank, London City and Ipswich. So many partner organisations that we are involved with, where we support teaching, learning, training of various healthcare professionals, physio, pharmacy, nursing, midwifery, as well as medical students. And we're about to hear now from one of my nursing colleagues who's the Paediatric Practice Development Facilitator. Here is Anna Landwall.
Hi there, my name is Anna Lanwarn. I'm the Practice Development Nurse for Paediatrics at Watford General, so I'm in charge of all things education and training. We look after students from nursing students all the way up to senior nurses. So we manage students when they come into placement, and then we run a third-year student bridging programme for the transition into qualified nurses, and then we create an education pathway all the way up to senior nursing. So we focus a lot on paediatric induction. We also focus on high dependency skills, so skills that they will be using in level 1 and level 2 critical care skills. We also look at trauma for children's A&E, and then we also support the CPD progression of our nurses as well. Our main aim really is to standardise the pathway, standardise the competence for our nurses, and make sure that we're delivering great patient care for all the patients that come to us at Watford General. So we're looking forward to being a teaching hospital, as hopefully that will support us in the role that we play with education for all our nurses.
And we've got many links with different organisations, educational organisations, and we really celebrate our links with those institutions through this project.
Yeah, I think the work that's been done locally in the last 12 months to secure Brunel University as a partner, the work that we continue to do with our local educational partners is phenomenal. It shows the commitment and dedication towards ensuring developing quality and high standards within West Herts NHS Trust. I think we've probably got some more work to do with our local education establishments, the local schools and local colleges, to really see that follow through in terms of enhancing not just the NHS but West Herts as an employer of choice for our local kids coming through, and we're going to Westfield Academy, one of the local schools in Watford next week, to provide a presentation to them in terms of the wonderful career opportunities that exist within the NHS. So what this does, teaching hospital status, alongside all the other great work that we do alongside education, just increases our profile, and that is a great thing for our communities in Watford, Hemel Hempstead and St Albans, and it's great for our community. Great that they've got an organisation and an NHS trust who's really committed to the future and has a plan in place. I think all of our staff and our community should be very proud of what's been achieved, and also very, very positive about the future.
Thanks so much, Andrew. It's been really good to talk this through, and just to say, we will literally be flying the flag for the West Hertfordshire Teaching Hospitals NHS Trust, as we are now called. We'll be able to see that on social media as we celebrate this landmark of changing our name to include teaching in our title. It celebrates all the teaching, learning, education, training and research that we're doing here within our organisation, and really hoping that we can build on what we do every day to give the best care to our patients. Ultimately, that's our aim. So thanks very much for joining us.